the common femoral vein seen here just below the inguinal ligament. Notice that the common femoral vein is seen just medial to the common femoral artery. Now the common femoral vein continues down the leg to bifurcate into the deep and superficial femoral veins. We note here the deep femoral vein coursing to the back of the leg, and we note the adjacent deep femoral artery. We also see here the saphenous vein, which joins into the common femoral vein above the level of bifurcation. Now it's important to realize that the superficial femoral vein is the vein that actually continues down the leg to become the popliteal vein behind the knee. And we note the superficial femoral vein coursing down the leg and accompanied by the paired superficial femoral artery. Behind the knee, that superficial femoral vein will become the popliteal vein, and we see the adjacent popliteal artery. Now at the level of trifurcation, the popliteal vein will become three different calf veins, and we note here the anterior tibial vein that's going to course anteriorly onto the calf, the posterior tibial vein seen posteriorly in the calf, and also the perineal vein seen to the lateral aspect of the calf. And it's because these calf veins are so small that it's difficult to see them on bedside ultrasonography. Let's now watch a video and learn how to perform the ultrasound examination looking for a DVT within the femoral vein system. We begin by placing the high-frequency linear array type probe. It's the same probe that you'll be using for vascular access in a side-to-side orientation over the common femoral vein and artery just below the inguinal ligament. Notice that we're compressing down with the probe, and essentially the DVT exam is a compression exam, as a normal vein will completely close with pressure down with the probe. Notice that we're sequentially compressing at different levels along the common femoral vein, compressing from the beginning at the top just below the inguinal ligament, all the way down through bifurcation into the superficial and deep femoral vessels. Now a clot will not completely compress with pressure down with the probe and thus will be identified on bedside examination. Notice here, it's standard to have the marker on the probe going lateral so that we know where we are with regard to the orientation of the probe versus the screen. It's best to position our patient slightly upright to distend the femoral vessels for the DVT exam, and as shown in this video, we actually had the patient with the head of the bed up about 30 degrees. We also want to have the legs slightly externally rotated to best orient so that we can place the probe directly over the common femoral artery and vein. Here we see the ultrasound findings that will occur when placing the probe as shown in the illustration towards the left. Note here the probe is placed with the marker dot laterally just inferior to the inguinal ligament, over the common femoral artery and vein as shown in the pictorial towards the right. Notice here that the common femoral vein will be seen medial to the common femoral artery, and because we have the marker dot oriented laterally or towards the left of the image, the common femoral vein will be seen to the right here. Here's a video showing the actual ultrasound findings of the common femoral artery and vein using color flow Doppler. We orient ourselves to the image to the left here, showing that the common femoral vein will be seen medial to the common femoral artery, and we note the ultrasound findings to the right, showing pulsatile flow within the common femoral artery, located just lateral to the common femoral vein, and we see the phasic hum of the blood flow within the common femoral vein seen medial to the artery here. While it's very nice to have color flow Doppler to differentiate the common femoral artery from the common femoral vein, we can also discern the two using grayscale or B-mode sonography, as shown in the video clip here to the right. Here we note the common femoral artery to the left or lateral to the common femoral vein as shown medially. Notice that the common femoral artery has more hypertrophic walls and also pulsatile flow within it, differentiating it from the common femoral vein as seen medially. Continuing down the leg, as shown in the probe position in the illustration to the left here, we see the following ultrasound findings in the illustration to the right. We note that the femoral arteries bifurcate at a level above the common femoral vein, and here we see the superficial and deep femoral arteries in a location just lateral to the common femoral vein. We also see a very important landmark, the saphenous vein, joining into the common femoral vein at this level. It's very important to visualize the saphenous vein, as it's really the only superficial vein in the body that we worry about clot formation within, as it goes directly into the common femoral vein and can propagate up into the IVC and into the heart. Here we see a video clip using color flow Doppler demonstrating the bifurcation of the femoral artery into the superficial and deep femoral arteries. And here we see that bifurcation point right there. Notice that the femoral arteries are located laterally or towards the left of the common femoral vein, which we see located medially or towards the right of the image. In this video clip, we'll note the bifurcation of the common femoral artery into superficial and profundus femoral arteries using grayscale or B-mode sonography. We note the common femoral vein is shown towards the medial aspect of the image or towards the right, and here again we see that bifurcation point of the common femoral artery into the superficial and profundus femoral arteries as labeled there. And we just remember that point that the artery generally bifurcates at a level higher than the femoral vein. In this video clip, we're able to get a good look at the saphenous vein joining into the common femoral vein, and we see the common femoral vein located medial to the common femoral artery. Note that the saphenous vein has the look often of a little hat on top of the common femoral vein. And we note here also the turbulent flow of blood here within the common femoral vein as this was taken in a hypotensive patient. Now let's turn our attention to the anatomy of the popliteal fossa. We note here the popliteal vein and the popliteal artery. Remember that the popliteal vein is going to be in an orientation located more posterior to the popliteal artery, which will be located more anterior. Here's how to perform the focused DVT ultrasound exam looking into the popliteal fossa. It's best to have the patient sitting up to further distend the popliteal vein, and I like to have the patient sitting up with the leg dangling over the bed. I can then pull up a chair and move anterior to the patient. We'll place the high-frequency linear array probe high within the popliteal fossa, sequentially compressing at levels down all the way down to trifurcation. Notice that we're using our other hand to stabilize the anterior knee as we press with the probe posteriorly. So again, we'll start high within that popliteal fossa, compressing sequentially all the way through the levels of the popliteal artery and vein, down inferior there, all the way down to trifurcation. Here's the anatomy that we'll see with the probe placed as shown in the illustration to the left. Notice that the probe is placed into the posterior aspect of the knee behind the popliteal fossa, again with the marker dot oriented laterally. Thus, we'll see the following images as shown in the illustration to the right. Note that the popliteal vein will be located closer to the probe or posterior to the popliteal artery, which will be further away from the probe or more anteriorly located as shown in this image. In this image, we'll use color flow Doppler to further differentiate the popliteal artery from the popliteal vein. And in the video clip here to the right, we can see the pulsatile flow of blood within the popliteal artery as seen anterior or further away from the probe than the popliteal vein, which is seen more posterior than the artery here. Notice that we see a little bit of phasic flow of blood within the popliteal vein. This video clip employs B-mode or grayscale sonography to show the popliteal vein and popliteal artery. Again, we can see the popliteal artery located more anterior than the popliteal vein, and we can see the pulsatile movements of the popliteal artery differentiating it from the vein. And in fact, we can see a little bit of turbulent flow of blood within the popliteal vein here, and located more posteriorly than the popliteal artery. When performing the focused lower extremity DVT ultrasound examination, we want to first identify the femoral and popliteal arteries and veins using B-mode or grayscale sonography. Now, color flow Doppler ultrasound can be helpful in differentiating the artery from the vessel and also making sure that you're looking at vascular structures, but is not essential. Most of our information will actually come from B-mode sonography. We want to apply compression to the vein, pressing down with the probe in the short axis or transverse orientation. In a normal examination, the walls of the vein will completely touch together. Conversely, if a DVT is present, the walls of the vein will not completely touch together, as a thrombus within the lumen of the vein will prevent the walls from completely collapsing. Here we see normal compression of the common femoral vein, and we see here the common femoral vein to the right of the common femoral artery, which we see to the left. Note we're looking in the short axis or transverse orientation, pressing down with the probe, and note with pressure down on the probe that the common femoral vein completely collapses and that the walls, the anterior wall and posterior wall of the vessel, meet. We also see compression of the saphenous vein, that little cap on the top of the common femoral vein. So a completely normal exam of the common femoral vein at the level just below the inguinal ligament. Here we're looking a little bit more distally at the common femoral vein at the level of the bifurcation of the common femoral artery into superficial and profundus femoral arteries. And we note here complete compression of the vein as we push down with the probe. And note again that the anterior and posterior walls completely meet together. Now let's move down the leg to look at the normal compression exam of the popliteal vein. Recall that the popliteal vein is going to be seen towards the posterior aspect of the image, or closer to the top of the image here, than the popliteal artery. As we press down, we note complete compression of the popliteal vein, and we see here that the artery still stays open. So again, this would be a normal examination. This video clip is taken from a patient who presented to the emergency department with a painful and swollen leg. We're using Doppler flow to first identify the target femoral artery and vein. We can see here the Doppler pulsations within the femoral artery noted lateral or towards the left of the image. We see here the femoral vein towards the right or towards the medial aspect of the image, and note the lack of Doppler flow. Looking within the vessel, we can see swirls of thrombus within the femoral vein consistent with clot. And we note also the saphenous vein on top of the femoral vein is also thrombosed. We note here that there's no Doppler pulsations within the femoral vein as a result of blockage due to the clot. Now that we've identified the target femoral artery and vein using Doppler flow, we can switch over to grayscale or B-mode sonography. Here we're looking at the femoral artery as it bifurcates into the profundus and superficialis arteries, and we note here towards the medial aspect of the artery or towards the right the femoral vein. Again, looking within the femoral vein, we see swirls of echogenic clot consistent with fresh thrombus. And we note again that the saphenous vein off the top of the femoral vein appears clotted as well. So our next move would be to apply compression down onto the vessels to look for compressibility of the vein. Here we note we're compressing down with a high-frequency linear array type probe, and we can see indentation of the femoral arteries towards the left. But note here the failure of compression of the femoral vein due to the presence of thrombus within the lumen. And we can see the thrombus moving around as we press down with the probe. Again, a positive DVT exam based on the fact of failure of compression of the femoral vein. Now let's look at another video clip showing a positive DVT in a patient presenting to the emergency department with a painful and swollen leg. We're using Doppler flow again to target the femoral vessels, and we see the pulsations of the femoral artery lateral to the femoral vein. We note here the absence of flow within the femoral vein, suspicious for a DVT, but our next move would be to apply compression down with the probe. Here we're compressing with a high-frequency linear type array probe directly onto the femoral vein, and we note the failure of compression of the vessel. We can also see a rocking movement of the thrombus within the lumen of the vessel. Notice that it rocks back and forth as we apply pressure down with the probe. Again, a positive finding for a DVT of the femoral vein. This video clip was taken from a post-surgical patient with a painful swollen leg. We're applying compression down to the common femoral vessels, and we notice right away a positive finding within the femoral vein. We see here echogenic swirls of clot, and notice the failure of compression of the vein with probe pressure. Here we also see the saphenous vein towards the anterior part of the image above the femoral vein, also with clot formation, and we notice that the saphenous vein fails to compress down with probe pressure. Now let's move down the leg and look specifically at the popliteal vein. Here are two video clips. Towards the left, a B-mode or grayscale sonography image, and towards the right, color flow Doppler. We identified the popliteal vein as seen towards the top of the image, effectively posterior to the popliteal artery. And we can identify the color flow flashes, the pulsations of the popliteal artery, as seen deep to the image here. Notice the echogenic swirls of clot within the popliteal vein, and to the left here we're compressing down, and we note the popliteal vein fails to compress secondary to the DVT. This video clip was taken from a patient who presented with a painful swollen calf. We identified the popliteal vein as seen to the top of the image or posterior in relation to the popliteal artery, which is seen here anteriorly or towards the bottom of the image. Now we're pressing down with the probe, applying pressure to the popliteal vein, and we notice a positive finding. The popliteal vein fails to compress with direct probe pressure. Now what's interesting, as in contrast to other clips in this module, we don't really identify the swirls of echogenic clot within this popliteal vein. Thus, this was an older clot that had been more organized with time, thus giving a darker appearance, more hypoechoic in nature. Now let's turn to a discussion of some potential pitfalls within DVT ultrasonography. In the femoral region, lymph nodes may appear as a thrombosed vein with a failure to compress on bedside sonography. Therefore, it's very important to adequately determine the location of the femoral artery and vein and compare that to the location of the lymph node. The lymph node will be a single structure unlike the paired femoral vessels. Also, the lymph node will usually be seen more superficial to the vascular structures of the femoral artery and vein. Here's an example of a femoral lymph node. Notice that it has the appearance of what could be construed as a DVT. We see the node, and it looks like it has echogenic material within it, but this is the normal ultrasound finding of a lymph node. Notice that it's a single structure and not related to the common femoral artery as a DVT would be within the common femoral vein. Here we change the magnification or the depth of the ultrasound image to better investigate the lymph node in its relation to the femoral vessels. Note the single node, the femoral node seen superficial to the femoral vessels as seen deep within the image. Note that the node is single in contrast to the paired femoral vessels seen deeper. As we progress down the leg, we can encounter another potential pitfall within the realm of DVT ultrasound, and that is the alternative finding of a Baker's cyst. A Baker's cyst can be encountered just behind the knee within the popliteal region. This cyst can result from an outpouching of synovial fluid from the knee joint, usually in patients with advanced arthritis. Unfortunately, the Baker's cyst can rupture, spreading inflammatory joint fluid down the leg and can present very similarly to a DVT. This video clip demonstrates the typical appearance of an unruptured Baker's cyst. This Baker's cyst was found in the popliteal region of a patient who was referred to the emergency department for a swelling behind the knee. Here we see the typical appearance of a cyst, that is that of a dark or anechoic fluid collection on bedside sonography. In this video clip, we're going to change the depth of the ultrasound image to better interrogate the Baker's cyst and its relation to the popliteal artery and vein. Here we see the single superficial Baker's cyst to the right in its relation to the popliteal artery and vein seen deeper on the image and to the left. And note that they have very different appearances, that the Baker's cyst is a single structure in contrast to the paired popliteal vessels. In this video clip, we see a large ruptured Baker's cyst tracking down the calf and closely approximating a DVT on clinical examination. We see a short axis view to the left, and I'm going to start with the probe high within the popliteal fossa right here. I'm going to move the probe down the calf, and we can see that the fluid collection spreads all the way down the calf. In the long axis view to the right, I'm going to start by showing the superior axis to the left and inferior to the right, and we can see the fluid collection of the ruptured Baker's cyst tracking from superior